The eye is a complex structure containing various cells, structures and membranes that together enable us to detect light, colours, shapes and movement. The vitreous gel is one such structure. It contains a collagen fibrillar layer and glycosaminoglycans, primarily made of hyaluronic and, to a lesser extent, chondroitin sulfate. It is thought to have two primary functions, the first protecting tissues within the eye, such as the lens, from oxidative damage due to its role in oxygen metabolism. The vitreous gel also acts as a barrier, preventing the invasion of cellular components into the eye. At the structural interface between the retina and the vitreous lies the internal limiting membrane, or ILM, which itself is composed of collagen as well as laminin and fibronectin. It is thought that laminin and fibronectin act as the glue between the cortex of the vitreous and the internal limiting membrane, as they are known to have a high affinity for collagen. As a person ages, the cortex of the vitreous can detach from the ILM. Detachment is commonly observed in patients around the age of 60. Detachment can start with the liquefaction of the vitreous gel, causing the collapse of the collagen fibrillar network and aggregation of collagen fibers into bundles. The combination of liquefaction and fibrillar collapse causes the vitreous cortex to detach from the ILM. This process is referred to as posterior vitreous detachment, or PVD. It is part of the natural aging process and is not seen as dangerous. Symptomatic vitreomacular adhesion, or VMA, is an age-related progressive and sight-threatening condition. It is a consequence of incomplete PVD, which occurs when part of the posterior vitreous remains attached to the macula. Laminin and fibronectin have both been suggested as having a role in vitreomacular adhesion, as these proteins promote the attachment of the vitreous cortex to the ILM. VMA is diagnosed by ophthalmologic examination and confirmed by imaging technologies such as optical coherence tomography, or OCT. If unresolved, symptomatic VMA can manifest itself as vitreomacular traction, or VMT, and macular hole, both of which can result in metamorphopsia and blurring of visual acuity. Macular hole can result from vitreomacular traction, where the partial attachment of the vitreous creates small breaks within the macula. Until now, the early stages of VMA were observed for progression using the watch and wait approach, with surgery being seen as an option only in the later stages of the condition. However, if left untreated at an early stage, VMA can often progress to a more severe form, highlighted by the fact that almost 3/4 of stage 2 macular hole patients progress to stage 3 or 4. Vitreomacular traction can have a major impact on a patient's quality of life, compromising daily activities such as reading, driving, and the ability to work. Early intervention is seen as being favorable due to the unpredictable nature of this condition. Jetrea ochraplasmin intravitreal injection is the first and only FDA and EMA-approved pharmacologic agent for the treatment of symptomatic VMA and its manifestations, including vitreomacular traction and macular hole. It is a recombinant truncated form of human plasmin that has been formulated for intravitreal injection. Like plasmin, Jetrea intravitreal injection exerts enzymatic activity over fibronectin and laminin, which make up the protein matrix of the vitreous body and the vitreoretinal interface, inducing a clean separation of the vitreous from the vitreoretinal interface. It is also known to promote the liquefaction of the vitreous gel, in part through its cleavage of collagen. It has been suggested to activate other proteases that may promote liquefaction, such as elastase and metalloproteinase, capable of cleaving other structures in and around the vitreous due to plasmin's ability to activate such enzymes. Therefore, it produces a dual effect of vitreous liquefaction and vitreoretinal separation for the resolution of VMA, enhancing the natural aging process. Jetrea, with its unique dual-effect mechanism of action, is the first and only one-time injection option for the early resolution of VMA and its manifestations, vitreomacular traction and macular hole, meaning there is no need to wait until these conditions have progressed to more severe forms before intervention. This will reduce the risk of debilitating visual impairment and provides hope when no other treatment option is appropriate. Jetrea offers retina specialists and patients the convenience of a one-time intravitreal injection as a treatment option for rapid, sustained resolution of earlier stages of vitreomacular traction, including macular hole.